Care Coverage Forum. Today, we will be discussing what condition we find our healthcare system here in Bermuda and what options are for the future to best take care of the health and wellness of the people here in Bermuda. As we have seen, and most recently, healthcare costs are rising, and as citizens, we are making increasingly difficult decisions on how we address our healthcare concerns. The concept of universal healthcare coverage is one option as to how we can address, how we can work on Bermuda and the health of us as individuals. We have seen through history, the United Kingdom has the National Health Service. We have seen in Canada, and even most recently, the United States struggle with the Affordable Care Act as how to cover their citizens in need of health care. In 1948, the World Health Organization declared health care a basic human right. And so with that in mind, different countries have been looking at how to best take care of their citizens. And so today on the panel, we have Brother Jason Haywood, current president of the Bermuda Trade Union Congress, Ms. Claudette Fleming from Age Concern, and Dr. Ricky Braithwaite of the Bermuda Health Council. And so the beginning of today's panel, each member of the panel will speak to who they are and their agency and how they see this healthcare concern in Bermuda being addressed by universal healthcare coverage. And we'll start with Brother Jason Haywood.
Thank you, Brother Lattimore. Good morning, brothers and sisters. The Bermuda Trade Union Congress 2019 panel discussion is basically focused on providing affordable and accessible health care in Bermuda for all. Like Brother Lattimore said, the WHO has declared health care a human right. I believe it to be a right. Everyone should have access to affordable and accessible health care. We recognize that the cost of Bermuda's health care is alarming to all workers and their families. The BTUC has selected this year's theme as a means to implore all stakeholders to commit to finding solutions to Bermuda's healthcare crisis. And I do say crisis purposefully. The Bermuda Health Strategy Report 2014 to 2019 states, compared to other high-income countries, Bermuda's health system is not providing value for money as measured by health outcomes for the level of expenditure. I take that statement to mean that our system is broken, that we pay way too much into our system for the outcomes that we receive. It is undisputable that Bermuda's healthcare is overly strained and failing Bermuda's residents. This is evidence as all residents do not have access to basic health insurance coverage and healthcare contributions are not affordable. So we don't have all our residents insured, and our residents that are insured are finding it extremely difficult to pay their health care premiums. In addition, the long-term health care needs of our seniors are not being met. And it's going to be a growing concern as our population continually ages. Healthcare provider fees are largely unregulated and overutilized, seemingly placing profit over people. At the end of January 2019, the Bermuda Health Council published the 2018 National Health Outcomes Report. This report detailed the island's health system costs for the fiscal year ending the 31st of March 2017. The report highlighted that healthcare expenditure increased by additional $20 million year over year to $723 million. Collectively, we pay $723 million on healthcare. And all 64,000 residents still do not have access. That is shocking, alarming, and unacceptable. We also see in that same report that more people are now paying for healthcare out of pocket. This was up 23.3% year over year. And more people, healthcare is covered now from donations. This was up 47.5% year over year. So our overall health expenditure is up. However, there's an increase in persons who are paying the health care out of pocket, which means they don't have insurance. And then there are increased portions of our population who are relying on donations so that they can have access to health care. According to the 2018 National Health Accounts Report, Bermuda's per capita health expenditure stands at $11,336 per person. That outranks most countries in the world. I believe that's firmly in the top 5 worldwide. Many senior citizens are finding it extremely challenging to cope, as a large portion of their pensions are earmarked to pay for prescription drugs, diagnostic tests, and other associated health costs. This financial burden depletes their limited disposable income, leaving seniors with limited resources for other basic necessities. Many Bermudians are electing to go without health insurance coverage because it is simply unaffordable. Further exacerbating this precarious problem, there is an increasing number of employers who are offering workers vendor contracts in order to avoid having to pay benefits, especially the mandatory health insurance premiums. And so today a worker is at work and is a full-time employee of a company. On Monday he returns to work and is offered a vendor contract. That vendor contract then makes that individual a self-employed person who is now responsible for the earned insurance contributions. This is becoming more common in the workplace. And it puts the workers in a very precarious situation. The BTUC is advocating for a sustainable and improved healthcare system and requests that all stakeholders make a concerted effort to ensure that there is universal healthcare coverage in Bermuda. We call on all stakeholders to work together to ensure that, number one, all residents have access to basic health insurance coverage. Number two, healthcare coverage contributions are affordable. Number three, all residents have access to healthcare services. We need a healthcare system that is people-centric rather than profit-driven. Universal health coverage should be the aim, and affordable health care should be viewed as a human right and not a commodity. Health protection coverage is crucial for every human being and to the economy as a whole, since labor productivity requires a healthy workforce. And employment effects on the health sector significantly contribute to overall employment. In fact, good health is a prerequisite to sustainable development, economic growth, and equality. Universal health coverage must involve equal access to needed health care for all people, whether they live and work, wherever they live and work, no matter if one is poor or wealthy, one is a man or a woman, or one is elderly or a child. Equitable health coverage does not occur automatically. It requires inclusive policies addressing inequities resulting from access barriers both within and beyond the healthcare system. It is encouraging to see that the Ministry of Health seeks to establish a roadmap to create a unified health financing system to enable subsidy reform and universal coverage. And if one has the opportunity to meet with the Minister of Health, if you go into our office, there is a chart. And written on that chart, it says GOAL, Universal Health Coverage. And that is extremely encouraging because we know it's a difficult journey, but we know it is vitally important for our current and future generations. We also have to realize that individuals must commit to healthier lives. The government must commit to mapping out a clear strategy with regulations that meets Bermuda's healthcare needs. Healthcare providers must become more efficient and cost-effective. Failure to act will put more lives at risk and will keep many residents locked out of access and affordable healthcare. Health is a human right for everyone. However, Bermuda is facing a severe health protection crisis. In the absence of universal health coverage, care is often not acceptable, available, or affordable. Progressing towards universal protection in health requires to engage in 3 important steps. Number 1, identify the extent of gaps and deficits in legal coverage, availability, and affordability of services, as well as assess the financial deficit that needs to be closed. Number 2, develop an enabling policy framework addressing issues within the health sector and root causes of these issues beyond the health sector, such as poverty, precarious work arrangements, and unemployment. And number 3, implement inclusive legislation in line with fiscal space assessments and closing gaps in accessibility of healthcare. It also requires fair financing mechanisms and adequate benefit packages in order to be meaningful for Bermuda's population. Universal health coverage can make significant contributions to the realization of the right to health, notably by ending financial exclusion and by contributing to strengthening national health systems that provide health care that respond to local needs and by contributing to the progressive realization of the right to health in Bermuda. Thank you.
Thank you, Brother Jason and Dr. Braithwaite.
Good morning, everyone. I'd like to thank Brother Jason and Dr. Fleming for the opportunity to sit up here with them to talk about something that's very passionate to all of us. Ricky Braithwaite, I am the acting CEO and Director of Health Economics for the Bermuda Health Council. And just to give you a sense of who the Bermuda Health Council is, we do a survey pretty much every year, and people tend not to know what the Bermuda Health Council is or what we do. And since we play such a central role within the system, I do want to take a moment to at least talk about our role within the system and our role towards universal health coverage. So the purpose of the Health Council is to enhance, regulate, and coordinate. When you talk about enhancing health care, we mean that the care that we receive can always be better. Whether we receive better quality care, whether the standards by which care is delivered are always improving, whether technologies that we use, there is a role for enhancing health care, and the Health Council serves the role to facilitate the improvements in the care that's delivered. Secondly, our job is to coordinate. Our current health system tends to feel somewhat isolated at times. You feel as though your physician is acting or operating within their own space, and there's not as many connections to all the other providers as you think should be. We also feel like we're often fragmented or feeling that our system's in pieces. There is an opportunity for us within the Health Council and within you as the public to find ways to better pull ourselves, the pieces of our system together to have a more collaborative and more consolidated system that works better for the people. And finally, in terms of our purpose, it is to regulate. So it's important to have someone to answer questions, to deal with concerns, not only to listen to those things and observe the things, the gaps that Jason mentioned that exist within our system, but then to subsequently act on them. It's not enough to just listen, but the next thing has to be around action. So the goal of the Health Council, the third component, is to regulate. And so we are around action. Action when we hear concerns within the health system. So to get to universal health coverage, we have to not only do things a little better, but we have to do things more together. So we have to, again, we have to enhance, which means that we have to do things better. We have to coordinate, which we have to do things more together. And then we have to hold each other accountable to do the right things, which is where regulation comes in. So therefore, this opportunity to use this platform that we have this morning to talk just represents another opportunity for us to have us here on this panel and those listening around this country to start to come together more towards the common goal of health for all. As Jason mentioned, health is a human right. It's not something that should be based on how much money that you have or your history. It is what you should be able to receive in the moment that you need the care. And the more that we have honest and open conversations and discussions, and we actually seek the truth when it comes to healthcare matters, the closer to the goals that we will get. So I hope today is the opportunity to have these kind of open conversations amongst yourselves and those up here on the panel and amongst the joining streaming public. Thank you.
Thank you, Dr. Brathwaite. And Dr. Fleming?
Good morning. I too would like to thank the BTUC for this opportunity. I want to, in particular, congratulate Senator Hayward on his leadership, most recently in the age discrimination discussion that's taking place at the House. And I mention that because when I got the invitation to come today, knowing the type of results that I know we're going to see in that area, I feel more than hopeful that we're going to get some good traction with this discussion today. And hopefully you'll challenge him to kind of do the same things that he did with the age discrimination discussion and take it as far as it has to go until we see some real substantive change. I'm also pleased to be with Dr. Brathwaite, who is very knowledgeable about the system, and is also, behind that knowledge, there is passion and commitment to see that the equity that we're discussing today comes to fruition for Bermudians. Age Concern Bermuda has as our mission to promote the rights and responsibilities of older adults. I want you to remember this as I provide my introduction, the rights and responsibilities. As you know, the population is aging quite significantly, and as a result, we have a strain on our economy in terms of our healthcare burden. We also, there are other factors that include some demographic changes, less younger people being born, etc. And that is probably one of the reasons why we find ourselves here today, because the pool that is now in need of the services is growing larger and larger, and the services aren't getting any cheaper. Now, there are two, traditionally, when we talk about healthcare, universal healthcare, and these are the questions that I think are important for our discussion today. We have to understand, what do we mean by that? I was in a conference in the Caribbean a couple of years ago, of all the Caribbean states, CARICOM conference, and some of the countries said, well, we have universal health care, and I had to ask, what did that mean? What does that mean for you? Well, we can go to see our physician so many times in a year. That's not universal health care for Bermudians who are used to traveling to the East Coast etc., for all types of coverage. So, what does it mean? We have those of us who do have healthcare coverage, particularly in the private sector. We have had the benefit and access to high quality and probably the most expensive types of care, if we're going to the East Coast, in the world. That, for some, has become a right. I get employed. My employer bears the burden for the most part, chooses the insurance company that we will partake in, matches the contribution, and I pay. Will that mean the same when we become the payers? These are the questions that are kind of underneath the discussion that we are having today. In terms of our older adult population, like I said, there tends to be a distinction between acute health care. That's that health care that, if you broke a leg or you had a heart attack, you'd expect to go to a physician, a hospital, and get treated. Then there's also long-term care, which is separated, usually separated from acute coverage. And Brother Jason mentioned in his speech that that's aspirational. That's something that we would want to cover. Long-term care, that's the care of older adults who are just in a chronic state and getting frailer and frailer. At the present moment, we have very limited coverage for long-term care. Future Care and did something very revolutionary, and a few years ago introduced a home care benefit that we is it now a part of the SHB? Not yet, but we're striving to make it a part of the SHB so that many others who are insured can partake in that. But in terms of institutionalized care, long-term care is not covered. So those are costs that are not a part of your insurance premium that you pay today. So I hope that in the discussion, I know as our membership is 4,800 persons strong, and we've surveyed them consecutively for 2 or 3 years, and their number one concern is healthcare costs. Number one. And their number two concern, interesting enough, is healthy living. You would think that would be first, and then healthcare costs would be second, because if we get the healthy living right, we get the healthcare costs right. But the healthcare cost is there because that is what is hitting our older adults today. We have, as was mentioned, one of the highest rates in terms of expenditure for healthcare, but we also have very high rates in terms of our chronic diseases, etc. So we're paying more money for healthcare, and we're sicker than most people. So what I want us to consider today in our conversation, I think there's very few people that don't want to see the universal sustainability of healthcare, and age concern is among that group. We want to see affordable health care for all ages. But what I want us to consider is, to what extent will that health care coverage be available, and whether or not we are prepared to cover those costs. So whether we want to look at from cradle all the way to long-term care, and whether we're prepared to pay those costs. And that is the real conversation. That's the real conversation. I think many of us can agree that healthcare should be a basic right. What extent are we in the general populace? What sacrifices are we prepared to make so that it is available to all? I want to thank you again for inviting me, and I certainly look forward to the discussion that we're going to have.
Thank you, Dr. Fleming. So in this portion, I will pose a few questions to the panel, and then we will open it up to the floor. And so in your mind, hopefully we don't use all your ideas. grasping what you would like to see or hear from the panel. So the three panelists have each talked about particularly the cost of healthcare. How would universal coverage impact the overall cost, or how the providers, I guess, bill the citizens of Bermuda?
So we're talking about universal health coverage, and there's two concepts, just to make sure that we're all talking from the same vantage point. So universal health coverage is this notion, it's a concept that everyone can receive basic access to 5 different types of care. There's health promotion, there's preventive care, there's curative care, there's rehabilitative care. So, for example, if you get in an accident, that you're able to go to the physio afterwards. And then there's things like palliative care, which is the 5th dimension of care, for things like pain management or end-of-life care where you just need hospice care, those kind of things. So there's a definition by the World Health Organization that says universal health coverage, which is a coverage of these 5 different areas, should be available to every person within a country without that person faring as though they'll go into financial ruin because of it. It doesn't say that all the benefits that are available within a healthcare system should be available, but the basic things that should allow you to manage a condition, to prevent a condition, should be available to you without having to go into financial hardship. Universal health care is often seen as kind of national health plans, right? So in terms of a nationalized system within the UK, or Medicare in the US, which covers the population within the US of seniors, or a Canadian system, that's universal health care. So there's two different concepts. But in terms of the financing of any of these systems, the goal is to create as much equity within these systems and to create as much equal contribution so that everyone can have access to these basic things. So how does a universal system help? A universal system says we as a community have to do this together. We have to pool our resources as much as possible. Those who can pay more will possibly pay more. Those who can pay less will possibly pay less, but everyone has access to the same benefits. So it is a system of sharing. And if you understand, if you have siblings or family members, when people share, the individual tends to come out a little ahead because everyone's contributing to the same pool. So that's technically how a universal system, whether it be to get to the point of universal coverage where you have access to these 5 different components, or a system that's built on a centralized kind of management, each of those systems is based on everyone contributing and everyone benefiting to the point that they can at least avail themselves of some level of health, as much health as is possible for that person.
Additional to that, as I stated in our opening remarks, our healthcare expenditure is $723 million for 64,000 persons. I support the notion that believes that there is enough money in our current system to ensure that everybody has the coverage in which Ricky just explained. Our population is shrinking, but healthcare expenditure is increasing. I believe there is enough funds where if we created the proper efficiencies within our system, that we can get the outcomes that we desire.
Thank you, gentlemen. Oh, yes, ma'am.
And I would agree that there is enough money in the system, but I do think that there are some courageous steps that also have to be taken, and that is to look at the cost structure, so what is actually being charged in the marketplace. And I think without that balance, that we may end up spending just as much or more on a universal system. So I do think we have to address the cost of care as well.
Thank you. With one thing you mentioned, Dr. Fleming, is the ability within private insurance to travel abroad for care. Is that something that you see as a problem or a benefit? Because every plane ticket, every hotel room adds cost to the millions that Brother Jason has mentioned.
No, I don't necessarily see it as a problem. For some procedures, we do have to travel overseas, like kidney transplants. You can't do that in Bermuda at the present moment. So that would be something that's important. I think where we have our medical procedures is an important factor in the cost as well. Like I said, the East Coast is probably the most expensive place that you could get care. It's just something that we're used to. We don't have to go there. So it all depends really on, the types of services that we want to acquire, need to acquire, according to our conditions. But that, again, is something that should be looked at. I do believe that our overseas expenditures are down from previous years. So we are getting better. But that reference was just made to the types of things that we are used to. A universal system is not, in most countries, is not a portable system. So I don't know if we're talking about portability here. Perhaps Dr. Brathwaite can speak to that. But when I say portability, what we're accustomed to, we can go in other places and in some cases still claim off of our insurance. When you have universal coverage, it is usually not portable. So it's based on local services.
Yeah, just to tie in that, if there's a need that can't be covered here on island, I think it is the right thing to do is to allow those to go overseas. What we have to be very careful about is, again, which organizations or which hospitals we use overseas. A simple example would be something like kidney transplants. Kidney transplants from one hospital to the next can range from $250,000 all the way down to $70,000. So you can get the same outcomes, but the pricing can be vastly different. And in some ways, loyalty plays a role in let's all just go to the $250,000 one because we know it. We need to do a better job of negotiating, and sometimes that means sacrificing your specific preferences, because if you cost $250,000, it's not you as an individual who's paying for it, it's the community. And if there's another option, a more feasible option, we as a community are responsible for negotiating and finding the best cost-effective option, not only for the individual, but for the sake of the community.
And I view the same issue as an opportunity. It is an opportunity for us to take a holistic look to say what services we require in our system that our system currently doesn't have, and then put long-term mechanisms in place so that we ultimately have those services on island that we travel overseas for. And so it can be an opportunity in terms of us increasing our local capacity to provide the services that are required by our residents.
Thank you. With the advent of a universal coverage format, you spoke to jobs and how being, whether you work for, but would this system add medical related jobs into the Bermuda market? Is that a possibility, or is that something with the advent of universal coverage?
So in terms of jobs, I think there is a great opportunity for the next generation to get into healthcare. There's a lot of healthcare technology positions that we probably don't emphasize as much. Anytime you improve a healthcare system, it creates opportunities for innovation, entrepreneurship. So I do think if we create, and as we create a more robust and collaborative system, it does lead way for our kids to go to school, to come into careers that would be helpful to the system. Right now, I know that there's a lot of emphasis on accounting and law, but there's a lot of different careers in healthcare that we're currently consulting out for. Right. So, for example, a medical physicist, we may be bringing them from the UK, where for hundreds of thousands of dollars, where we can have an on-island expert a kid who goes to school and goes into that career, and he can be not only for Bermuda, but that kid could end up being the resource for the region. So we have to start thinking a little outside the box and expanding that. If we're spending $723 million on healthcare, it is a pillar of our economy. It is a big part of the economy, and we have to treat it as though it is an opportunity for generations of people to get jobs in. And as I said, when you talk to other Caribbean islands, they look at us as the leader in these kinds of spaces. They understand that we're a lot more progressive than they are. And so if we can leverage our $723 million investment and to get a bigger return on that investment by producing strong leaders in healthcare that could serve the rest of the not only the Caribbean, but serve the East Coast as well. Right now we're doing ourselves an injustice by not tapping into that potential.
And Dr. Fleming spoke on this earlier in terms of opportunities. Right now we have an aging population. We have a shortage of long-term care facilities and providers. We have high levels of chronic disease. These are all opportunities for persons to get into the healthcare profession and provide services to that population. That, just based on our demographics, there is an increased demand for healthcare services within the country. We do have a shortage of Bermudian healthcare professionals across the whole spectrum of the healthcare sector. And so I think we do need to be a bit more deliberate in terms of challenging our smart young individuals into careers in healthcare.
I'd like to add, now, you would note that I noticed that among Dr. Brathwaite's description of what universal health care is, there was one part that was missing. Did anybody pick that up? He probably picked it. That's right. Long-term care. Remember I said the care that was missing in what universal health care coverage is. Now, this would be great for Bermuda if we were to include in what that traditional definition of universal care, long-term care. This, as Senator Haywood said, would open up the floodgates. It's really what the industry needs right now to get developments which will be building and training and entrepreneurs coming forth. They are not coming forth because there isn't a way to pay for older adults. Now, having said that, now that long-term care was not left out of those 5 things by accident. It's usually a separate discussion, and it isn't left out. It's left out because it's expensive. It's expensive. It would be great to include it. If we could do that, wonderful. I mean, fantastic. We'd be a model for the world. I'd love us to do it. It comes again down to what are we prepared to put into that bucket, that universal bucket. Now, consider this. The average Bermudian is 45 years old. I think we moved to 50% of the population in less than a decade. That means most of you guys in here, I can't see, so you're probably a lot younger than I can see out in the public. That's going to be us. This discussion we're having right now is about us. And we really have to consider, how smart would we be not to be doing this for ourselves? So I like the idea of including in there long-term care. It will mean increasing the cost. In terms of opportunities, I don't have a challenge, the healthcare industry is full of entrepreneurs. It is right now. They are some of the best entrepreneurs that we have. I think they can find a way to still be creative. I'd like to see more entrepreneurs getting into the preventative side, but right now, the way that this system is structured, most of the reimbursable rates are on the curative side. That's on the disease side. So that's where the emphasis is going. But if we shift the payments around, we may start to see some creativity in the preventative side, and we'll get the benefit of that.
Thank you.
Just one,
Okay, go ahead.
just one more number, and I think it puts it into perspective in terms of with the long-term care and the opportunities. So currently we have 3.8 working adults to every senior. So from a cost standpoint, it's 3.8 working adults are in essence helping to support seniors. In the year 2039, which is only 20 years from now, 20 years actually goes by pretty fast. I can attest to that. In 20 years, that number will be 1.7 working adults to every senior. So our whole economy plays a huge role on how we be able to support a ratio going from 3.8 to 1 currently to 1.7 to 1. You can look at that number and say, man, that working adult at that point in time will have to carry a lot. So how do we create a more robust economy? How do we, if we know that this is coming, how do we diversify our way of thinking? How do we become more creative? How do we look at long-term care to be more efficient? Because if we know that it's cost, if we're looking at the cost now, which I think some people say they're paying $7,000 a month in long-term care, and I think that even goes a lot higher for some places. If those costs have to be carried by that 1.7 of a person or 1.7 persons at that point in time, then it's going to be a heavy, heavy burden. And I don't know if that's a realistic expectation for someone to carry those kind of burdens at that time. So you take that $7,000, it's split by 3.8 people, you divide that, which means that instead of $7,000 that one person is in essence carrying, you double that. So that person who's working has to carry even more of the burden. So we have to become more creative in how we turn long-term care into a more cost-effective solution, knowing that someone is going to have to carry that, and long-term care needs are not going to go away.
The United Nations member states have agreed to try to achieve universal health care coverage by 2030. And it's also a part of their sort of sustainable development goals. I know, Senator Jason, you spoke to the government looking at coverage as a goal. Is that a reasonable time frame, or what would be a reasonable time frame for us to make a transition?
I believe 2030 is the world target. But in the world, we have both developed and underdeveloped countries. Bermuda is somewhat of a developed country. Well, not somewhat, but he is a developed country and considered a developed country. And we are well ahead of many countries in the rest of the world. So certainly 2030 would be well beyond the time we will require to have a system in place. I believe that we can achieve our goals within the next 5 years.
Maybe I'm super optimistic, because I always I ask my team this sometimes, why not 2020? We have 64,000 people on island. We have 64,000 extremely intelligent and dedicated people on island. Why not 2020? Why do we have to wait 5 years to provide people with the basics, the basic coverage? Why can't an article be written in the New York Times saying Bermuda's done it by 2020? Let's go down to Bermuda and find out how they did it. The question becomes, why not? I don't think it's a matter of we don't have the resources or the intelligence or the skills to do it. It's just a matter of will.
I think we could probably do it a lot sooner. Declare my interest as a member of the health councils. I don't want Ricky telling the rest of my council members that I said, hey, we can get it done a lot sooner. But I think we can. It's a matter of whether or not we, as stakeholders and certainly policymakers, make that the priority.
Thank you. I guess to Dr. Braithwaite, you spoke to regulation, and coming from a regulatory environment, we know that you play a large part in how healthcare will change. What particular regulations do you see are beneficial or might be an impasse to this transition?
So, from a regulation standpoint, one of the things that we believe is an opportunity for improvement is kind of the foundation of our system. So, for example, data. Data is an important aspect of our system that we need to improve on. So, in terms of regulating, we have to create a better data infrastructure so that we can make better decisions based on data. We can't just make decisions based on anecdotes. We have to say, what does the data say, and how can we change things based on data? So what we've been doing a lot of is regulating the collection of data and the standards by which data is created. So for example, at a physician's office, we're looking to convert to International Classification of Disease version 10, or ICD-10, which is an international standard. We're looking to convert to that, and regulating that is part of regulation, saying by the end of 2019, we're going to transition our system to ICD-10. Everyone else in the world is using it. We have to become more in line with that so that we can kind of benchmark our own results with those of the world. Everyone talks about the regulation of fees. Before you can regulate fees, what you have to do is get a good sense of the cost of care. It's noble to say, well, I'm just going to tell you that you can charge $50, but it's irresponsible to say you can charge $50, but I haven't actually looked into how much it actually costs, or I haven't helped you to reduce your cost. For example, within prescription drugs, we know that we probably aren't getting the efficiencies that we can because we're not, our volume-based purchasing, we're not using the numbers that we have in a good way to get the best prices. So I can't go to a pharmacy and say, reduce your prices if I'm not also helping you get the product at a cheaper rate in the first place. So we're working on regulating, but we're working on regulating systematically in a way that's fair, and it takes into consideration the things before you get to the point of the price or the delivery of that care. So regulation is important. We're looking to regulate prices of prescription drugs. We're looking at fair pricing for things like doctor's visits and specialist care. Although controversial, regulation has come in the form of a fixed discount model or a grant model to the hospital. That is regulation. That means that there is a constraint or a budget that's given. That is ultimate regulation, because as a family, you would know that if someone put a budget on you, someone is regulating how much you spend. So these things are regulation, and we're working as much as possible within every sector. We're not targeting any one sector. We're targeting all, because every sector requires some kind of regulation.
Okay, at this time, I have a few more questions, but I'd like to open to the floor if there are any at this time. I guess we could get one of the mics to move around. Brother Shadden James has a microphone. Go from there.
Hey, good morning, everyone. Dwight Jackson, BUT. Since we're on the subject of regulation presently at this moment, I do have a few other questions. But in in any national and global venture, you need partners. So I'm asking you, can we actually control regulation? Obviously, it would have to be done through legislation, but is that something that's reasonable?
So just to repeat the question,
Can we actually control regulation?
right. So regulation is a result of legislation. You put the authority within certain hands to uphold the law. The question is, if someone doesn't follow the regulations that you put in place, is there enough teeth or enforcement of that after the fact? So employers' compliance is a big conversation that the Health Council has on a regular basis, where the authority to ensure that every employer who's supposed to pay health insurance pays health insurance. We know that some employers, regardless of what the law says, they still don't pay their health insurance. So the question is, does the Health Council, as a specific example, have the legislative teeth or the ability to enforce that to a degree that will stop people from not paying their health insurance? The answer is sometimes we don't have as much power over the situation as we'd like to, so we have to be creative. So the simple answer to your question is yes, regulation is possible, and to follow through on the full scope of regulation is possible, but sometimes you have to be creative. Sometimes you can't do it with an iron fist. Sometimes you have to have a more softer approach. So in this environment, we have to be extremely creative in how we regulate, because the community is small, and that plays a big part in it, and we have to be in some ways more considerate than if we were a arm's distance away from someone and say, I don't even know that person, I'm just going to regulate. We have to be a little more considerate in this current market.
Good morning, Brother Arnold Smith from the BIU. With insurance, now I as a parent, my children are insured under me through my employer, and also my older ones who are in college are insured up to 26. What if we could have our parents insured under us so that we could take care of our parents? Because at the end of the day, we have to take care of our parents. So, and I just put that to the floor.
That is always a question that we get, and I think in terms of universal coverage, that probably won't be necessary because everybody would have a basic coverage. However, let's look at the logic of what you're saying in terms of the way that we're currently structured. Insurers, who at this point, for the most part, are profit makers, they already know that your children are not going to cost that much money. And that if you're a working individual, that you're generally healthy. As an employer, which we are at age concern, every year we get a claims history from our insurer, and they tell us, what our claims experience has been for the year, and then they price us according to that. Most years, our claims exceed our premium. Most years, but we belong to a charity group, so we have kind of a discounted rate. And then they base our premium rates on that claims experience. So if under this current scenario, your parents were to be added to your employer's insurance, your employer would then get that claim experience, which would include your parents and everybody else's parents who decided to take it on the job. And hopefully everybody's healthy, but if they're not, you could imagine then what that claims experience is going to look like. That then will be, in our case, we present it to our staff and say, okay, well, it's going to go up. On average, our insurance goes up 10, 12% a year. And we say, okay, guys, are we gonna, are we gonna continue with this, and we have the highest one, or are we gonna drop it down a couple? So these would be, first of all, from a business point of view, you can see where that's just not gonna make sense. So it would be a hard sell to take to the private insurers. But let's say you could, then it still comes back to a conversation to you and your employer. How much are you prepared to pay in insurance, private insurance premiums for that coverage? Okay. Now, at our establishment, I think our health insurance premiums exceed all of our other expenses. That includes our rent and stuff. So, and we're only 3 point something big. So you could imagine if it was a bigger company. But that question is exactly why we need to have this conversation. Is it fair to finance healthcare in that manner? Is it fair to put the burden of the cost on the employer? And most of us are employed by small to medium businesses if we're not in the public sector. Is it fair to put it there? Or is it fairer, as Dr. Brathwaite and even Senator Jason are suggesting, that we go cast our net wider to the general community? And so now the risk in that now general community, we have younger people, and hopefully we don't have less and less of those people because they've left because they can't afford to be here. And we have people like yourself, and we have your parents. So that's my long answer to your short question. I hope that's helpful.
What's interesting with your question, brother, is that dilemma in which households find themselves in on how they can support their parents. Now, you're an individual who may have the means. What if you are an individual that don't have the means? And so, here's where the conversation has got to shift in terms of a mindset change in our population. It has to change in terms of, I have to also bear the burden and responsibility as a younger person in society for all seniors in our society. And so when we do deal with pools, then what we're ultimately doing is we want to ensure that there's enough money in the pot so that everybody is covered and that persons don't have to make those individual considerations. Persons don't have to grapple with whether or not I'm paying for healthcare this month versus paying for food. It's real considerations that individuals have to make, tough decisions that individuals have to make on a monthly basis now. What we're trying to do is alleviate some of the pressure on those who can afford it least.
Shannon, let's go to the back.
Hey, good morning. Philip Lewis from the ESDU. My question it was mentioned, I had to type it because it was a lot. It was mentioned earlier that we can do this by 2020, and also that Bermuda is part of the first world. I would say, in my opinion personally, that we are more of a second world country. And what I mean by that is that economically, we're too large to be a third world country, but we're too small to be a first world country because of our land mass and our population cap. I personally do not see it as feasible to accomplish this by 2020 unless we find a major cash influx or cash cow for the island. So my question is, what makes you see it as feasible to accomplish by 2020 or even in 5 years without a major cash influx into the island, without, say, like legalizing, say, something that was illegal and using other countries as a model for this example? Because we're not going to get the cash, in my opinion, to make something like this happen within 2 years. So what is the plan on you guys' part to make this feasible, or sorry, not you guys, make this feasible in 2 years or even 5 years?
So my assumption based on the question is this that you're talking about is universal health care, where you have one system that, much like a Canadian system or a UK National Health Service, those kind of things. So my response to the original question was that we can have universal health coverage where everyone has access to those 5 dimensions of health. Right. So that was the 2020. In terms of a universal health care system, that is yet to be determined. I do know that we've centralized hospital funding in 6 months, and with a lot of discussion, a lot of consultation. So, from a universal health care standpoint, can we move quicker than a lot of other countries? I think we are nimble because we are smaller. If you do look at if you talk about our income level, we are in the high income countries. Anytime I go to a conference and try to mark off the box to get a discount, they're like, "No, you're from Bermuda," right? So we are slated with the Swedens and the United States of the world when it comes to income. So can we create a system that's more equitable within a short period of time? Again, that question, I would turn it back to you and to the public of how much do you want a system that's more equitable? From a financing standpoint, I think since we spend the third most per capita in the world on healthcare, I don't think that we have a cash issue. I think we have enough financing within the system to support a universal type system here in Bermuda.
And I agree with you, but it was also mentioned about we need to open up our mindset. And okay, we're talking about the short term. We have numerous other countries to use as models for how they are making extreme amounts of cash short term. So maybe we need to get out of this old system and this old as an island and figure out how can we make this cash fast so that we can benefit people as a whole.
Well, I think we can move to an equitable system as fast as we like. And notice that word equitable as opposed to affordable. Equitable would mean that everybody who has the ability to pay pays what they are able to pay. And those who do not have access are given the access irrespective of whether they can pay. One of the interesting things that happened under the Affordable Health Act for the middle class, which was initially it was a shock even to myself, there was a big uproar, even among African Americans, educated African Americans, who would have supported, for the most part, would have supported President Obama. They took great offense when the price came for the Affordable Health Act amongst the middle class. It was higher than expected. So we use the word affordable, and I think the desire is there. And that should certainly be our aim. But I feel very strongly it's more likely going to be equitable. And what that will mean is that those of us, and I'm not talking about, the millionaires and billionaires, which would be great too, but likely not to happen in the first instance. I'm talking about you and me. Those of us who can pay more will pay more. Maybe even more than what we're used to paying right now. How do we feel about that? That's about being our brother's keeper. That's about saying, you know what? I know there are people who are in society, if it were not for my contribution, would not have fair and equitable access to service that I believe is a human right. And I believe so much that it is a human right that I'm going to pay my equitable share, which may be more than my neighbor to the right and less than my neighbor to the left. And that's where, when sometimes, Dr. Brathwaite and I may be in contradiction. We believe the same things. I just don't necessarily see where, in the first instance, it's going to be as affordable as people think it's going to be. It's going to be equitable. And the question is, back to you, sir, is that something that you can live with, or that the public is prepared to live with?
Shannon. Brother Shannon, I think Brother Bull had a question. Oh.
Okay, Mr.
Yeah, close to the.
Yeah, I'm a bit far away. Signal dropping. My response would be, okay, it goes back to the statement about open-mindedness. It doesn't necessarily have to be, so it doesn't have to come out of our paycheck. It doesn't have to be a deduction or a tax to say universal health care. There are other means to acquire cash that can be redirected or sent to this universal fund. And that's what I'm saying. We need to look as a people, as a country. We need to come out of our Stone Age way of thinking, and we need to, the key is money. And that's what we need to think. How can we as a country make the amount of cash to sustain this type of care that we need? Because it is ridiculous. If there should have been an RA in place, it should have been for the healthcare department. But, that's what we need to figure out. And for example, I'm just going to bring this up. Colorado has a population of 5.96 million. They made $1 billion last year from their legalization of marijuana. All right, so it's a simple math equation to equate that to Bermuda to figure out how much Bermuda, because we just did a poll, and 70-something% of the country wants it legalized. So 70-something% with that ratio, how much money would we make? An extreme amount. That money, I don't smoke. That money can be redirected into a universal health care fund. And we can fund that health care off of other means. That's what it means to be open-minded. I believe I really want universal health care. My mom was sick with cancer, and she died from it, sadly, and I was paying out of pocket. You know what I mean? So I would love universal health care in Bermuda, and I'm serious about it, but I believe we really need to look at it and find ways to fund it.
Thank you.
So I think the panel agrees. I think we agree. Me personally, from my standpoint, would I prefer the money come from outside of the country into the country instead of, because the assumption is that the cash would be already here, and then I would prefer if new money came in, right? So yes, from an economic growth standpoint, we have to be open-minded and creative. We don't want to continue to stretch our local population. We want to create more business and more opportunities for money to come into the island so that can be spent. Well, actually, a lot of money is coming into the island, right? We have a whole sector where there's a lot of money coming into the island. So again, the question has to be shared responsibility with the money that's already here, and can we create more opportunities for the money to come on island? I think there's enough cash available in the various sectors. We just have to have the hard conversations and hopefully get people on the side of saying, we're all socially responsible. We all have to put in. If my business is a multi-billion-dollar business, I want to see the same good stuff as I want to see good schools. I want to see good health. Those kind of conversations need to happen. I don't think I've had conversations where people are saying that, well, no one asked. They're just not asking us for it. And so maybe we need to have more of those conversations, because I think people care more than we probably think they do. but no one's actually engaging them in the conversation and saying, what can you do to support the efforts for better schools and better health and so forth?
Yes, good morning. Ed Ball from BPSU. Panel, thank you very much for your informative dialogue that you're having this morning. One of the questions that is often stated by the physicians is, I need to make a profit. Despite all what the regulation may want, what the trade unionists may want, what Eldercare may want, I need to make a profit. So how does their view of profit fit in with universal health care based on the models that you know, and also based on the ILO, UN, as well as PSI, people over profit?
First and foremost, healthcare should be viewed as a service. I don't want to turn every single healthcare provider into a capitalist individual who is just out to make money. Healthcare is a noble profession that we need to get more individuals into, and a lot of persons in the healthcare profession are not making huge profits. And a lot of employees in the healthcare sector are not making high remuneration. But there are some individuals who are taking advantage of our current system. And because our current system is not regulated, they charge what they know they can receive, and they do make a pretty penny. But part of the process moving forward will be regulation. And so once we determine our ultimate financing strategy as a country and agree to how we're going to finance our healthcare services, then the next part of it is looking at regulation. And Dr. Brathwaite spoke about the two areas of regulation additional to the regulation of the public provider, but also prescription drugs and healthcare providers. But in the meantime, what is aiming to happen is create the efficiencies so that when we say that you need to be regulated, we'll also help you to bring some of your costs down.
Any other questions from the floor? Sister Linda? Brother Shannon? Yeah, sure. Good.
Thank you, Linda Bogemans, BPSU. I do think that it will take a considerable paradigm shift in the way that we think about healthcare and our responsibility towards healthcare for every individual. We are going to have to make that decision as a public, but individuals are going to have to really answer the question, do we believe that healthcare should be for everybody regardless of their economic means? I think that's going to be an important dialogue we're going to have with ourselves and as a country. But if I can ask the panelists, if you could name 3 things that have to happen right now on your wish list to make this happen in a timely fashion, what would those things be? 3 things.
So I know
I got one each. If it's one thing we can do is we can have healthcare accessible right now, and so nobody should be denied from at least public healthcare institutions from receiving services that they require. At this point, there is barriers for some, but for example, if you walk into the hospital and you're uninsured, you will receive a service, and it should remain that way. But persons typically don't know that, but we need to have not just access for when you need it the most, but also access to preventative care so you don't get in a predicament where you need critical, when you're critical intervention stage.
To go on the note around preventive care, we do need to redo our essential package. So SHB currently covers, and this number has been thrown out a lot, about 95% of SHB, or standard health benefit, is hospital care. If you go to any report on the determinants of health, they'll say that health care, traditional health care, makes up about 20% of the reason that you end up in a condition, right? So your health care outcomes are your status, how you are living. Only 20% of that is based on you engaging in the healthcare system. The majority of our healthcare dollars in this country are spent on traditional healthcare. And when I say, whether it be doctors and the hospital and those kind of things. But we're not spending enough money on education, health education, financial literacy, so that when you do age, that you maximize your financial house. We're not spending enough money to understand how education is connected to health, or how your environment's connected to health. All those things we need to do a better job of. But specifically, we do need to redo our essential package, our standard health benefit, to include more prevention. And I think that's going to be a big first step, a big step towards universal health coverage. Another thing that I'll do two, another thing that we do need to do is look at means testing. So currently our money is distributed, let's say our subsidy money is distributed based on just age. Regardless of whether you can afford or not, or whether you have 10 billion, Jay-Z just became the first billionaire. So whether you were a Jay-Z or not, our subsidy funds are just based on your age. So there may be a need for means testing to determine who needs more money than someone else, and to provide that person that money to make up whatever gap they have based on their income. I know that, for example, if you're receiving a pension of $400 and your insurance is $500, what can you do? We need to look at premium subsidization and means testing for that. So those are two things that I think are important. But we do need that health in all policies is a cliche or is a catchphrase, but it's important to understand that health needs to be addressed in everything that we do. We need to start our kids learning early. We need to work on our open environments to ensure that there are safe places to play and to run and those kind of things.
I would say that we have to have a general consensus in the public of what the package is. Because once we understand what it is that we're striving for, then we understand our role in it. And the second would be to go to all of the stakeholders in a reasonable fashion to determine what their responsibility is in ensuring that universal healthcare coverage happens. And like I said, very few people would disagree that we all should have access to healthcare. The question becomes, well, what's your role in it? What's your role in it? Health insurance provider, health provider, recipient, and there's conversations they need to be had, and then we need to move toward it. We can't wait for the perfect opportunity. We just got to decide what it is and move toward it.
Good morning, Chris Ferbert, President of the BIU. Certainly, let me thank the panel for their discussion this morning on, when we look at healthcare costs. And certainly, I think let me start where Ms. Fleming left off. If we're talking about all the stakeholders, I honestly think that we have a real conversation about healthcare costs and bringing down the healthcare costs. Because certainly, when we look at the insurance, where they tell you your premium's going up by 10% this year, 15% next year, and your costs just continue to go up. And I'll give you an example. When the OBA government decided to tell Dr. Brown in the hospital that we're going to cut your services by this much, they just made the decision and they done it. So we need to real, and I agree, if you're going to bring all these stakeholders to the table, to have a real conversation as to bringing the cost of healthcare down, because certainly if we look at the cost of healthcare and the way how it's risen over the past 30 or 40 years, when people's wages haven't risen like that, they have not, and that's a fact. So are they going to be willing to come to the table and have that real hard conversation about how we are going to bring the cost down and look at new ways of trying to get other ways to sponsor universal health care costs? And if they're going to come to the table, because we invited them in 2009 to come at a town hall meeting to talk about the cost of health care and why, because the country's in a recession, why do you still feel a need to rise your premiums by 10%, 15%, and 20%, recognizing that the country is in a recession?
That would be the last question, as we have to close.
Great. Gwendolyn Crary. This question is for all panelists, just to hear you. At the cost of care.
You gotta come closer. Man, you gotta come closer to this guy.
I'm also, but I haven't heard any discussion about the cost of food. From my perspective, health is very much tied. Food that people are able to eat, and when I have visited marketplace, especially now on a retired person's income, a slice of watermelon for $10 or 2 tomatoes for $15 or $10 says to me that most people on very small fixed incomes cannot eat very nutritious food very frequently. And from my perspective, that would impact health outcomes, and all of the other things that we've been talking about this morning. So will someone figure out a way to tie nutrition also into this whole conversation about universal health care?
Excellent question. And in my opening remarks, I discussed the 3 important steps that were required for us to progress to universal protection. And the second step was develop and enable policy framework addressing issues within the health sector and root causes of these issues beyond the health sector, such as poverty, precarious work arrangements, and unemployment. And what that ultimately says is, if you just tweak the system, but you don't fix the inputs into the system, we're not going to get the outcomes that we desire. And so what you spoke to is having persons eating or engaging in more healthier lifestyles, but your affordability, your finances are based on your own personal economic conditions, and that's based on whether you're employed, unemployed, whether you're working in precarious work or whatever it may be. And so that is part of the policy framework that has to move forward in alignment with us having a sustainable system. That is part of the prevention conversation that we've been discussing. What is required so that we don't have the same level of inputs into our system or demand of healthcare services. And unfortunately, these are all serious issues to tackle on their own. Because you can bring up food, and I can then say, persons don't have adequate housing facilities, which lead into deteriorating health conditions. And then there are some seniors who have lack of food and lack of help, and they need care. And the family are not picking up where they ought to pick up. And that's why we find some seniors being dumped, literally dumped at the hospital. Family members take them to the hospital and leave them there. And those family members, their senior, had been neglected in their own home. And so, yeah, it is a greater societal conversation that we have to have regarding prevention, so that we can reduce the demand for critical care services.
So I think in general, I did talk about kind of the social determinants of health. Food is included in there, and we're not. Maybe my most direct answer is that we have to demand different. We have to think about the status quo and say it's not okay to have a slice of watermelon for $10. How can we change that? I know personally when I'm around friends, what I do is ask the question: why are we eating all this cheese again? Isn't there something healthier for us to eat? And I've seen little by little more fruit and vegetables have been introduced to the dinner table. So I think we need to all challenge the status quo. I don't think it has to be $10 for a watermelon slice. It doesn't have to be, $15 for a thing of oranges. It doesn't have to be, but we have to be willing and have the courage to step up and say it doesn't have to be like this anymore. How can we do it differently to get different results? How can we change culture to do that?
I think what you're speaking to, Gwendolyn, is a need for us to have a social safety net that encompasses all these things. And this, along with other conversations like the livable wage, are all a part of creating a better social safety net. And how do you eat an elephant? One bite at a time. You have to take them, so that you give the concentrated effort to each, because each is worthy of that focus. Both of my colleagues here have spoken also, and I started my introduction with the responsibility part of it. We all still have a personal responsibility, and we can take charge of our health, and we can require. I know there's a doctor that I know that says a physician hasn't seen him in 20 to 30 years. Now we won't all, we won't all escape. In fact, if we're doing things well, we should have a relationship with our primary care provider, and we should be keeping on top of our health. But there is some sense, based on the numbers, that we are not taking responsibility, that we're leaving it to the healthcare system to care for our health, and that is expensive for you, and it's expensive for the entire country. So you could take that same $10, buy some watermelon seeds, and grow them. And I met someone the other day who asked, we was from a quota country, to say, everywhere there's a box garden, and someone's growing, and here you have this wonderful environment. I'd expect to see more people growing because we have the environment to do it. But in some cases, we have lost that sense of responsibility. It's easier to take the dollar that we've earned to go and get some fast food over and over. That's okay every now and then, but over and over and over again, that then causes the health consequences that sends us to the expensive healthcare system. So how do we reverse that and include some of the things that you're talking about? I think it also gets back to that health education and helping to empower us as a people to make healthier lifestyle choices as well.
All right. Thank you very much to the panelists. Unfortunately, we are up against our time limit. If you have further questions, the panel will be here for a couple seconds afterwards. We do need to end our coverage. So on behalf of the Bermuda Trade Union Congress, I would like to thank Dr. Braithwaite, Dr. Claudette Fleming, and Senator Jason Hayward for the participation this morning and their valuable insights into healthcare coverage for us as citizens of Bermuda. They have given us plenty of food for thought and ideas of where to go to look for that next level of information. I'd like to thank all the participants from the audience who have asked valuable questions, and indeed for all those who have followed us along on Burn News today, as our partner has streamed it during the extent of this panel. My name is Donald Lattimore. I would like to thank you on behalf of the BTUC as well as my role as first vice president. And thank you again. And we bring this panel to a close.